Hello, Krackheads. This is Dr. Jeffrey Schnapp with Dr. Schnapp's House of Krack. Today, I want to talk to you about what I'm going to call Cannabis 101. In previous episodes, I've talked about how I'm able to utilize medical cannabis in my personal practice and how it benefits my patients. I'm going to talk to you about what cannabis is and kind of give you the real rudimentary bits of what cannabis is as well. So first we have the brand called Sativa. Sativa is an uplifting strain that is usually used for anti-anxiety, used for focus. Then you have your Indica. Your Indica is more your sedative. If any of you ever seen that show Disjointed, if you have, really cool show, not plugging it but kind of am at the same time, they talk about Indica meaning in the couch. Really, really funny. What that does is more of a sedative effect, more of a calming effect. Then you have the hybrids. I've always said hybrids is where the magic is. And that's where you combined these two strains to come up with something different. And there are so many hybrids out there that provide both an anti-inflammatory effect and a sedative effect. Or then you have strains that are, believe it or not, that will suppress your appetite. Yes, suppress your appetite versus giving you the munchies. All the magic is in the hybrids. Also, how you define these specific plants is how they look. Sativa plants generally have a longer and thinner leaf, where the Indicas are more short and kind of fat, bulky leaves. There's also CBD strains. Now, before I get into that bit, let me just define specifically THC versus CBD. CBD first is legal in every state. It is the non-activating portion that gives you that euphoria. THC, on the other hand, is exactly what you think it is. Tetrahydrocannabidiol. Yeah, try saying that 3 times fast. I dare you. Try it right now. Go ahead, go for it. But what this does is that's what gives you the euphoric effect. That gives you the head rush. That gives you the sense of being high. I want to talk about the CBD strains that have some THC in them, but also have an absorbent amount of CBD. Now, we're all familiar with CBD. CBD is cannabidiol, and that is something you can get. It's legal in all 50 states. However, when I say CBD strains, I also mean there are strains that have a bit of THC in them that activate into something a bit different. One of my favorite strains is called B4. It is here in Albuquerque. Luckily, we do have this strain. And it is a derivative off of the strain of Blue Dream, but a CBD portion. What this will do is it really, really helps with muscle relaxation and with a body effect. You're not going to get much up in the head because the THC is extremely low, usually lower than 4% for the most part. But you'll have CBD that's somewhere upward of 17% CBD. That is an absorbent amount in a flower. So as you can see, pot is not just pot. Weed is not just weed. You have various things that do various effects. You have your THC-driven cannabis that you're going to have a high euphoric effect. You're going to have another strain that gives you more sedative effect. Then you have your CBD strains that are really, really good for overall muscle relaxation and get that what's called a body high. Amber, hello there. Nice to meet you.
Nice to meet you.
So tell me what's going on with you today.
My whole back is really, really tight. I probably haven't had it adjusted in a couple of years.
Oh my.
So I could really just use a good tune-up in general. This isn't an injury, so I can take it off and we can pop.
Oh no, this is fine. It looks cool like that on camera too.
Thanks. Yeah, so it's mostly back though. Like range of motion, rotation is really tight. In that area, my hips are a little angsty, but otherwise pretty good.
Okay. Let me have you face down first. Can I check everything out that way? Perfect. There. All right. I'm going to have you lie on your back, if you would, please.
Okay.
I'm going to get your hips by yanking on them a little bit.
Awesome.
Awesome, I love that. I love you already. That's awesome to say. Fuck. There we go.
Ha ha ha. Beautiful.
It's like the wind up and the pitch. There it is. That gets the true hip right there. The others, just like so. What I'm going to do here is lift you up with one arm, kind of roll you a little bit more toward me. My arm's going to go behind you, and you're going to be adjusted all the way from tail to head.
Okay.
That way. Roll toward me a little bit. I might just go right here. There we are. Relax your arms. Perfect. Oh, there it is, right there.
Mm-hmm.
It's sticking out like a sore thumb. Yeah. That's always fun. There we are. Bada bing, bada boom. Can we help you on up here?
Good, solid adjustment.
That's what I like to hear.
Beautiful.
Perfect.
Beautiful. Thank you.
Oh, my pleasure. You take a deep breath. Does it feel a bit different when you take a deep breath?
Yeah. Like even just standing up.
I love this stuff. This is awesome.
It's fabulous.
I can do this every day too. This is amazing.
Thank you so much.
It's my pleasure.
Appreciate it.
Hello, Jade.
Hello, Poppy.
It's nice. Hello, Poppy. I love that. Thank you for bringing that. Thank you for bringing that to the show. It's great to see you again, as
Thanks.
always.
Mm-hmm.
How are you feeling nowadays?
I'm feeling good. I still seem to be having this issue with my lower back, and I don't know. I mean, I went down from 2 pillows to 1 pillow, and I'm still having this issue. My bed hasn't changed. I've never had problems before. I don't know what it is. I keep waking up with a really sore back for the past couple of weeks. But my shoulders from last time have been, I haven't had an issue.
Perfect.
Like that sorted itself right out.
Okay.
But still right here in my
Is it
lower
directly
back.
across the back, or is it more one side versus the other?
I'd say it was more across, and it feels like deep, like in the lower back.
Yeah.
So I don't know what it could be.
Okay. Let's check it out now.
Okie dokie.
Face down first, please.
Okay.
It's right centralized.
Yes.
You're like, yes! There it is. Let's see this, Jade. I'm going to have you on your side with this side up first.
Okay.
As we say in German, die rechten Seiten auf. Look at Brits and Germans together. What is this?
There's a joke in there.
That is a joke. When you find it, let me know. There we go. Und dann auf die andere Seite. You're going to speak German by the time you're done with
I
this.
know.
I'll keep it a secret, I promise. There we go, I'm gonna drop a bit. And onto your back, my dear. Legs nice and straight. Perfect. I'm gonna get really low with this one because it's really centralized. Now, hold on. There it is. Und du machst.
Oh, there we go. Yeah.
Let's get this side today first. Here we go. Sweet.
Wonderful. Thank you.
My
That was
pleasure.
so good.
I'm so glad.
Thank you.
Anytime, sweetie.
Oh. Yes.
Great. How about the low back when you stand up? Let's see how that is.
Let's see. Yes.
So that wonderful.
Yes.
Okay.
It does. That like throbbing is gone.
Good.
Yeah.
I love that.
Thank you.
Oh, my pleasure.
Me too.
My pleasure. Woohoo!
Thanks.
Hey, thank you again for watching. And remember, like, comment, and subscribe. And hit the bell so you can see when our next video comes out.